Okay, so today our doctor has ordered 0.5 milliliters of sterile water to be injected IM into our patient today. So the first thing I would do is make sure that I have the right orders from the doctor and check and see if my patient has an allergy to sterile water. Since my patient doesn't have any allergies, it's okay to go ahead and give the medication. I would then gather my supplies with my vial of sterile water and a 3 milliliter syringe with alcohol preps and gauze. So then I would go ahead and wash my hands, and following the 6 rights, I would make sure I have the right drug, the right patient, the right dose, the right route, the right time, and the right documentation. So I selected a 3 milliliter syringe that is a 22 gauge. So then I would go ahead and start drawing out my medication, making sure that I had everything right. You first clean off the top of the vial with the alcohol prep, and while that is drying, I can go ahead and get out my syringe. All right, and making sure that I have the right vial and the expiration date is intact. I would aspirate 0.5 milliliters of air. And then now that my vial is dry, I would go ahead and inject the 0.5 milliliters of air, flip it over, and aspirate 0.5 milliliters of air while I got my air bubbles out of it. Then I would check and with another nurse as my second verification that I have 0.5 milliliters of air. Then I would go ahead and recap or get another needle and replace the needle. And then I would go and knock on the patient's door with all my labeled medication with me. I would then wash my hands and put on my gloves. Then I would instruct the patient to verify their name and date of birth, and then I would introduce myself and explain the procedure and say that your doctor has ordered 0.5 milliliters for an IM injection or shot. And then I would check and make sure, again, if the patient has any allergies to this medication or if is wearing an allergy band. So then I would do all my vital signs, my blood pressure, LOC, my just general assessment. And then I would identify some IM sites, which is your deltoid, your vastus lateralis, your ventrogluteal, and your dorsal gluteal. So today, say I'm giving my patient an injection into the deltoid. And then I would, gather all my supplies, clean the injection site, inner to outer, with friction for 30 seconds. And while that is drying, I would, for a third time, check that I have 0.5 milliliters in my syringe and with the doctor's order that this is the right patient, no allergies, we're ready to go. I would warn my patient, 1, 2, 3, stick. Slowly inject the medication, remove, checking for blood, and apply pressure, and immediately put this into the sharps container. Once the patient's bleeding has stopped and my needle is in the sharps container, I would document that I inserted 0.5 milliliters of sterile water into the deltoid and what arm I put it in, and how the patient took the procedure, what time of day it was, and that's it. How'd I do again?